Do you know what diabetes is and how it affects your body? It's often misunderstood as a condition caused by consuming too much sugar. However, it's more complex than that. Diabetes is a chronic disease that fundamentally alters how your body transforms food into energy. Let's break it down. The majority of what we eat is converted into sugar, or glucose, which then enters our bloodstream. This surge in blood sugar signals our pancreas to produce insulin, a hormone that allows our cells to absorb sugar and use it for energy. Now imagine if this system doesn't work as it should. If your body doesn't produce enough insulin, or if your cells resist its effects, sugar builds up in your blood, leading to high blood sugar levels. Over time, this excess sugar can cause serious health complications. That's the essence of diabetes. It's not just about sugar intake, but a malfunction in the body's ability to process sugar in the bloodstream. So diabetes is essentially a malfunction in the body's ability to process sugar in the bloodstream. Did you know there are different types of diabetes? Indeed, the world of diabetes isn't as straightforward as it might seem. There are three main types: type 1, type 2, and gestational diabetes. Type 1 diabetes happens when your body, for some reason, stops producing insulin, a hormone that's crucial for regulating blood sugar. It's often diagnosed in children and young adults, and managing it involves a lifelong commitment to insulin therapy. Then we have type 2 diabetes. This is when your body still makes insulin, but it doesn't use it the way it should. This type is the most common, and it's often linked to lifestyle factors like poor diet and lack of exercise. Lastly, we have gestational diabetes, which can develop in some women during pregnancy. The good news is, it usually goes away after the baby is born, but it does increase the risk of developing type 2 later in life. Each type of diabetes has a distinct set of causes and risk factors, but they all involve a problem with insulin. So, what have we learned about diabetes? In our journey to understand this chronic condition, we've discovered that diabetes affects the body's ability to process sugar. It's like a miscommunication in our system, where the sugar that should be fueling our cells instead builds up in our bloodstream. We've also learned about the three main types of diabetes: type 1, type 2, and gestational diabetes. Each of these types has its own unique characteristics and triggers. Type 1 is usually diagnosed in childhood and involves the body's immune system attacking the cells that produce insulin. Type 2, on the other hand, develops when the body becomes resistant to insulin and is often linked to obesity. Gestational diabetes is a temporary condition that occurs during pregnancy. While there's no cure for diabetes, it's not a life sentence. With a healthy lifestyle and medical treatment, diabetes can be managed effectively. Remember, knowledge is the first step to managing diabetes. Stay informed, stay healthy,